Hi, my name is Portia Hill, and I'm a registered nurse at the Coliseum Medical Center. I'm a senior at Columbus State University, and I have to do a project on what will better have better patient outcomes. And what I decided to do was reposition it to reduce pressure ulcers because I'm a wound care nurse, and I've been a wound care nurse for the last 2 years. This right here is a stage 4 pressure ulcer. And what a pressure ulcer is, it's where someone lay for a long amount of time, and the pressure points end up getting, some nerves. The pressure points end up getting like infected. And so what I decided was turning patients every 2 hours will decrease in pressure ulcers. And the study that I did was what I found was patients that has like a moderate to high on their Braden scales, those were the ones that we focused on, that came in like to the hospital or came from long-term care facilities with the already Braden scale of high to moderate. It costs the hospital an average of over $129,000 per year for one admission of a stage 4 pressure ulcer to treat. And like I said, this is the stage 4 here. And what I was saying was the pressure points. You see the back of the head, the shoulder, elbow, buttocks, and heel. These are the places that will mainly break down if this patient isn't repositioned or turned how they're supposed to be turned. I also have the ear, the shoulder, the elbow, the hip, thigh, leg, and heel. And on the very bottom, I have the elbow, rib cage, which I found was, I never seen a pressure ulcer on someone's rib cage, but I guess anything is possible. The thigh and the knees and the toes. And the ones I see most frequently are the buttocks and the heels. And so my objective is, by the end of this project, the nurses and the CNAs will come up with a way to reduce pressure ulcers to have positive patient outcomes. I want to decrease the incidences of pressure ulcers in my facility where I work. And how we will do that, we'll get with the nurses and CNAs to accomplish this goal. So like I was saying was, I did some research, and what I came up with was repositioning was the best way to decrease pressure ulcers in these patients. The residents are the patients that were immobile every 2 hour, and if we put them on a discrete every 2 hour turn schedule, these residents' pressure ulcers would decrease by 73%. And the rationale for this project will be reposition is important to cut the cost of treatment to pressure ulcers. And like I said, research has shown where just by turning a resident or repositioning them will help with the prevention. And I found this was very neat, that it said the cost of pressure ulcer treatment exceeds more than $1 billion annually in the United States alone. And that's why I said prevention of pressure ulcers is the key. If we can just prevent them from getting the pressure ulcer. My evidence for change is to introduce a system that will allow us to be reminded of repositioning these residents. And what I came up with was I read about a research study that was done in 4 different hospitals up north. And what they did was they decided to play musical cues over the overhead, where like if someone has a baby, you hear the little music, the lullabies playing over the overhead, where every 2 hours the music will be played to remind the CNAs or the nurses that the patient needs to be turned. And I thought about maybe if we played it for over 20 seconds every 2 hours, someone will be reminded that this patient needs to be turned. And the music will be played from 7 a.m. to 10 p.m. And that way it won't disturb the patient's sleep at night. And I thought it was a good idea of a way to be reminded that the residents that are most immobile can be repositioned. I decided that all facility staff will receive in-person education, videos, and handouts, and the visiting family members receive informational pamphlets on pressure ulcer prevention and an intervention featuring musical cues. The musical cues can be with lyrics or without lyrics, and that will be solely up to the facility what music we decide to play over the overhead. I also came up with if we put a turn clock in the patient's room over, I would say, over the headboard or on the wall where the nurses write their name, if we can put a turn clock, and we will start it at 12 o'clock, and every 2 hours we return them, and like it says, right back to left. And that will be another way, because when the CNAs and nurses come in the room, we'll see the time clock and it's 1:30 now, and if it's still on 12, and I'll say, well, wait a minute, this resident needs to be turned in 30 minutes. So it's on even numbers, 12, 2, 4, 6. And I would like it to be where they're on their back at 8 o'clock, 12 o'clock, and 6 o'clock for meals. Because I thought about it, I said, well, if they're on their right side, when it's meal time, that won't work. So I came up with a way where we can kind of keep them on their back when it's meal time, and then the other times on their right side and on their left side. And the music I came up with for our facility was, let's see, trying to write these on it. Trying to pull up the hyperlink. What I'll do is I guess I'll go to YouTube.
Oh, you can't get that from here. It's gonna be blocked.
It's
Yeah.
YouTube will be blocked?
We can't watch that at the hospital.
Oh, okay. Well, maybe that's why it won't let me.
It's not gonna let you pull up anything from YouTube.
Okay. Well, the music I came up with is by the Byrds, and the name of it is Turn, Turn, Turn.
Oh,
Yes, and I said, if they hear the turn, 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 for 20 seconds, you'll know, well, someone needs to be turned, because that's the music, that I came up with. I thought it was real neat also. And I also came up with a turn schedule will be placed on the ADL care book for the CNAs. Well, here we don't have a ADL care book, but the CNAs have where they can go in and document, and they will see that, and also on the front of the chart. So that will remind the nurses that this person needs repositioning. And like I said, in one study, the cost of repositioning accounted for 73% of the total cost for pressure ulcer prevention. And by putting something on the front of the chart, I thought about putting like a lime green little just sticky mark, and it'll just be like, reposition, and then we can come up with a way where the CNAs and the nurses will know that this person needs repositioning also. And my recommendations will be, for the first stage of change will be monitoring the patients that are 65 and older without pressure ulcers. And then, like I said, the patients that has moderate to high levels on their Braden scales with scores of 13 to 14 and 10 to 12. And these will be the patients that we focus on for the street repositioning system. I will say that I think the charge nurse or the directors can come up with in-services about the musical cues, and the staff will know the music is played to go turn the patient. If the CNA or the nurse cannot get to the patient, they need to do it in a timely manner. If they can't get to either one of these patients, they need to be documented accordingly. And then we'll know to, as soon as someone is not busy, to go turn this resident or patient. And this is the little clock that I came up with, or the turn schedule that I came up with, that will be placed in the patient's room. And to have a little dial though on it, and every time we go in the room, we'll put it on the dial, and that's what side they'll be on. Like I said, I tried to get it where they're on their back for meal time instead of on the left and right side. And the turn schedule that is placed on the patient's ADL book needs to be initial each time the CNA turns the patient. That way we can keep up with it also. We can make sure that the CNAs are repositioning these patients when going in doing patient care. So I would like for them to sign off each time that they're being turned. And also, this book should be reviewed by the charge nurse, and it should correlate with the other turn methods that are put in place, which is the musical cues, the turn clock, and then the ADL book, or the system where the CNAs go in and chart. We will need to see that they are charting, that they're repositioning the patients. And also, if a patient declines, that needs to be documented also, because we have to have a trend. If we're going to do a study to see, are these people pressure ulcers being reduced by repositioning, a lot of times we have patients that refuse treatment. So if they refuse being repositioned, that also needs to be documented, and it needs to be documented accordingly. And my recommendations was, with the results I found, I feel like this change should increase with positive patient outcomes, and decrease in pressure ulcers will take place, especially if all the staff are willing to adapt to the change in the facility. Because one thing about it, we as nurses, we really don't, like change sometimes. We like to just, be in our ways. So I think it will cut down on a lot of nursing time with treating pressure ulcers. If all we got to do is hear the music, go in and, or get a buddy, go in and reposition the patients, or put wedges up under them, or pillows between them, wherever the bony prominences are on them that are that will break down and get pressure ulcers. I feel like this change should be evaluated weekly to see how we're doing with it, to see has any new pressure ulcers been reported, or have the old ones been declined. And I would like for the old pressure ulcers to stay stable or improve. I feel like if they're stable, we still have time, to treat it. But if it declines, then really this study is useless. So what I'm hoping for, that the pressure ulcer will either be stable or improve weekly. And I say in a month, the change should be evaluated, and 20% of the new diagnosis of pressure ulcers should be decreased. And I also would like to evaluate the health of the patient, far as albumin levels, nutrition, and any other new medical diagnosis, because we know that with low albumin levels, and if they're not getting good nutrition or a certain kind of medical diagnosis, the wounds or the pressure ulcers are not going to heal anyway. Well, weekly, it'll take more time if they have other things going on with them. And my expected outcomes of my proposed project will be that new diagnosis will decrease, like I said, by 20% in a month of promoting the change to the new facility. And if we have a decrease in pressure ulcers, then the patient would have to be evaluated individually and determined by their health status, and also lab values. And I have listed the things that will cut the high cost of treating pressure ulcers and cut back on the times nurses spend treating the pressure ulcers. With the new changes in place, a lot of teamwork. This change to the facility should be positive for the patient, family, and the staff. Using the musical cues, the turn clock, and putting something on the chart or the system where the CNAs document and put in what they're doing, I feel like that it will have positive patient outcomes, or the family members can see that we are concerned about their residents, or their family members breaking down and getting pressure ulcers, because that is a big problem in a lot of medical facilities. And I have seen where a patient get a pressure ulcer, and next thing you know, the ulcer, the wound has sepsis. The person has sepsis and died. So it is a big concern within the medical facilities, and I feel like repositioning would be a good intervention, to put forth, even though we know that, okay, you reposition, but a lot of times we don't have patients on a strict 2-hour schedule. I feel like in no facility, no one is being turned just every 2 hours, because we have so many other things going on. The CNAs, they have so many patients, and then us as nurses, we have a lot going on. So a lot of times the patients are forgotten about, and then when we think about it, we'll go in there, but a lot of times it's way past 2 hours. Mm-hmm. So I feel like these things will remind us to turn the patients in a timely manner. Do you all have any questions at this time?
No, not really. I would just recommend too that you get the nurses to teach some of the family members, because some families stay here all the time, and get family involved. That would probably be a benefit too, is some family members want to do a lot of the care for the patients. So getting them involved and teaching them about the turn clock would also help, or the music cues.
Yeah, and that's what I thought about too. I think I said that on a previous slide, that we will get the family members, we will give them pamphlets, we will explain the music, because if they're in the room visiting and then they hear the turn, they can go get someone, or they can do it themselves. And then, that will cut down even more time for us as nurses and the CNAs. If the family member is in there and they hear the music, okay, you need to be turned, because hopefully the turn clock will correlate with it. And if it's 2 o'clock and then you hear the music, and if the turn clock is 12 o'clock, okay, my family member needs to be turned. They haven't been turned since 12 o'clock and it's 2 o'clock now.
Yeah.
So that is a good thing to get them involved, because they spend 80 to 85% of the time in the room with the family member. So that is a good idea to keep them involved also. Any more questions? All right, well, thank you.
Thank you.